We begin with alarming numbers in the battle against coronavirus as cases of COVID-19 surge at a record pace. On Wednesday, the U.S. reported the largest single-day increase in cases since the outbreak began. There were more than 38,000 cases across the country. That passes the previous record high of 36,000 from April. Now, Texas Governor Greg Abbott has announced he is temporarily pausing any further reopening phases as the state responds to the recent increase in cases. California, Texas, Florida all broke their own records for the most cases reported in a single day. The CDC predicts nearly 30,000 more Americans could die by mid-July. Federal funding for coronavirus test sites is still scheduled to end on June 30th, despite some states still asking for help. Our Manuel Bojorquez is in Florida with how the state is handling the spike.
I think we had COVID on the ropes. We were doing very well, and it's making a comeback.
Dr. Sergio Segarra is the chief medical officer of Miami's Baptist Hospital. He says he's seen a significant increase of coronavirus patients in the last few days, mostly walk-in cases.
These are community-acquired COVID infections as opposed to nursing homes.
Florida was one of 5 states reporting record-high increases in coronavirus cases on Wednesday. Another was California, where more than 7,000 people tested positive. Rises in hospitalizations and rates of infection prompted Governor Gavin Newsom to warn that a rollback of the state's reopening is not out of the question. As cases rise in the South and West, the one-time epicenter of the outbreak is taking precautions.
People coming in from states that have a high infection rate must quarantine for 14 days.
The governors of New York, Connecticut, and New Jersey warned those in violation of the rule would face a fine of up to $10,000. Their list of states includes Texas.
There is a massive outbreak of COVID-19 across the state of Texas.
Governor Greg Abbott said certain parts of his state could face new restrictions after seeing more than 10,000 new cases in 2 days.
The situations in the hospitals continues to worsen.
In Houston, hospitals are at 97% capacity, and statewide hospitalizations rose 57% in the last week. Several states, including Texas, are reporting large increases in cases among young people as bars and restaurants reopen.
I understood the chance I was taking going out, and obviously now I'm paying that price.
21-year-old Adriana Carter says she and her friends caught the virus after a night out in San Marcos, Texas. She says while she was being careful, many others were not.
We're trying to figure out a new normal, and I hadn't gone out since the bars reopened. It just so happened that the one night out I did contract coronavirus.
And in another reminder that the young are still very much at risk from this disease, 17-year-old Carson Davis, a high school student in Fort Myers, Florida, was airlifted to a hospital Monday and passed away the very next day due to complications from COVID-19. Manuel Bojorquez, CBS News, Homestead, Florida.
For the latest on the coronavirus, I'm joined by Dr. Angela Rasmussen. She is a virologist at Columbia University, and she joins me now from Seattle, or right outside of Seattle, rather. Dr. Rasmussen, thank you for being with us. So for those of us who are not on the front lines, we're hearing, hospitals in Houston, 97% capacity. How bad is it?
It's really bad. When you consider that right now we're seeing this dramatic spike in cases, we know that there is a delay between when the cases begin to spike and when we start to see hospitalizations and when we start to see deaths from those hospitalizations. So if right now the cases are still spiking and we're seeing 97% hospital occupancy, that bodes very poorly for the next several weeks. As we continue to see cases go up, we will continue to see the hospitals become overwhelmed. And the result of this is going to be very, very bad for public health and for all of those people who are sick and getting sick with COVID.
So can we dive into why this is happening now in certain states like Florida and Texas? I mean, here in New York, we saw this happen. We saw this spike happen. We saw, hospitals challenged at capacity. And now we've sort of past that point, and now we're seeing this happen in other states. Can you talk about the disconnect there? Why is it happening so much later in these other states?
I think that there was a lot of confusion about what flatten the curve actually means. So we effectively did that in many of these places, but flattening the curve just means that we are taking some of the burden off of the hospital system. It does not mean that we are eradicating the virus from our communities. So virus is still there. It is still being transmitted from person to person. And without the proper testing capacity, we are not able to intervene and break those chains of transmission. So when some of these states have opened up, sort of under the assumption that the worst is behind them, that's simply not true. And these cases of community transmission that were already occurring at a low level have now increased to a high level. And it doesn't look like there's an end in sight. It's really very, very worrisome.
So are you saying that these states started to reopen too early?
They really did. I mean, many states have started to reopen early, but some states, such as New York, such as Washington State, where I am now, have undergone a phased reopening plan, in which reopening, it was occurring very slowly after meeting certain epidemiological benchmarks and benchmarks for testing capacity and so forth. Some of these states did not do that. Arizona, for example, opened up bars and restaurants, and people essentially went back to normal. And that is a recipe for disaster, which unfortunately we're seeing right now.
So also talk to us about what this tells us about the virus, because, you know, in some areas there was some speculation that perhaps as the summer months came and the hotter weather came, that the virus would not be as successful. But we're seeing it proliferate in states like Florida and Texas, where it's quite hot indeed.
That's right. So I think a lot of people were making the assumption that it might be seasonal simply because 4 of the other known human coronaviruses are cause common cold-like illness and are seasonal. We don't know if it's seasonal. We don't know if it's going to get worse in the fall, but it appears that it's not seasonal in the sense that it goes away during the summer months or that it's particularly affected by heat and climate. And another thing to consider is that we do know that transmission is more likely to occur in enclosed spaces indoors. In states such as Texas and Arizona, where it's extremely hot outside, you'll actually have people sitting indoors more often because they will be inside with air conditioning. And that, especially when there are crowds of people and no mask usage, very little attention paid to physical distancing in some cases, that's really a recipe for widespread transmission and so-called super spreader events.
That's a very good point. I don't think that that's one that many people have considered, that when you're inside, even if it's very hot outside, everyone's crowding into those air-conditioned spaces. It's almost as if you need the temperatures to be just right to allow for large groups of people to be outside a lot of the time. So what would you advise these states that are seeing these spikes? Would you tell them to go back into lockdown if you were giving these governors advice?
I would have told them to go back into lockdown 2 weeks ago. I definitely think they should consider that now. What's really problematic is that I think in general in this country, a lot of people have really lost their appetite for being willing to participate in a long-term quarantine. And there really isn't support financially for a lot of people to be able to even do that. So while a lockdown would be the best approach, it may not be realistic to expect governors to implement that in those states. But what definitely does need to happen, at the very least, is to start limiting some of these events with large crowds. For example, President Trump's rally in Arizona the other day. Events like that are really unnecessary and they don't need to be happening. At the very least, those types of things should be canceled and more emphasis should be placed on masks, physical distancing, and hand hygiene, these measures that we know at least can reduce transmission in the community.
Absolutely. And Dr. Rasmussen, we have heard that Dr. Fauci is saying a vaccine could be ready by the end of the year. How optimistic are you about that? And even if that is the truth, even if we do have a vaccine that's available by the end of the year, if that happens, how can we expect, how long can we expect it to be able to circulate around the country so that everyone who needs it can get it?
So that's really an open question and one of the most important questions. And unfortunately, my answer is I don't know how likely that is. A lot of that is going to depend on the phase 3 clinical trials that are getting underway right now. And one scenario may be that the first vaccine that comes out isn't the final vaccine that we have. Even if one of these vaccines shows that it is even a little bit effective at reducing disease severity, for example, rather than completely protecting people from becoming infected, something like that would be a good stopgap measure until we have another vaccine that provides long-term, robust protective immunity. So a lot of it is really going to depend on the next couple months and the results coming out of those clinical trials. I am a little skeptical that a vaccine would be available certainly for the entire population by the end of the year. I think perhaps we could see a vaccine being rolled out to the most high-risk communities. But again, that's completely dependent on if there's any kind of evidence of efficacy in these phase 3 trials.
All right. Well, Dr. Angela Rasmussen, thank you so much for sharing your medical expertise with us. We really appreciate it.
It's my pleasure, Tanya. Thanks for having me.